grabbing a few of your health forms for us. Since this is your first appointment, we will be filling out a lot of paperwork, unfortunately. But hopefully, with us together, we can get everything filled out accordingly, successfully, and quickly. Okay. Do you have any questions for me before we begin? Right. Now, of course, I have a lot of questions for you for your file and to start your pregnancy journey. Okay, perfect. So to start out with, we do have an emotional or social needs questionnaire. Are you comfortable taking that? Okay. It just lets us get a better knowledge of you. If you're not comfortable answering any of these questions, you just let me know. Okay. Perfect. So let me give you an example here. Pregnancy is a time of many changes in your life, physically, emotionally, and social. We believe that good pregnancy cares involves more than just taking care of your physical needs. Your feelings and how you cope with these many changes are very important. To help understand your emotional needs better, please complete the following questionnaire. Okay. Okay, perfect. So, your name, if you can just confirm the spelling for me. Today's date I got. Due date. Okay. Okay, so for education and school, what was the last year or grade you completed? Okay. Now, are you currently attending a school, a study program? Okay. Okay. And how many languages do you speak? Okay. Okay. If you work outside your home, how many hours are you working per week? Okay. And what is that occupation? Okay. How do you feel about your job? Now, do you have any specific plans for work or study once the baby's here? Okay. Perfect. Let's just... Good. So for living arrangements, what type of housing do you have? Apartment, house, other? Do you own or rent? Can I get the zip code on that? And are you comfortable or satisfied with your current living arrangement? Okay. Are you able to list all the occupants in that home, whether that be roommates, family? Okay. All right. And what's the relationship to you? Okay, moving right along to family and relationships. Okay. Circle the best description of your current relationship status. So are you married, single, divorced, widowed, living with a partner? Or in a steady relationship but not living with a partner? If you have a partner now, how long have you been in a relationship with this person? Okay. And is the current partner the father of the baby? Okay. And how would you describe that relationship? Happy, uncomfortable, some problems, stressful? Do you feel comfortable in that relationship? And what is your partner's occupation? Okay. How does your partner feel about the pregnancy? Now, how supportive would you say your surroundings are? How supportive of your friends, your family? Do you have a good support system for you and baby? Okay. You feel like you can count on these people? Good. Okay. Okay, now, do you have any other children that are not currently living with you? Okay. Skip that. Now, some for your history here. When you were a child, who raised you? And are they still involved with your life currently? Okay. Now, when you were a child, did your family experience any of these difficulties? Again, if you're not comfortable with any of these, you can tell me and we'll skip it. But alcohol abuse in the home, domestic violence in the home, sexual abuse in the home, serious illness or death of a family member, divorce of parents, abandonment by parents, foster care of you or siblings, or another serious problem that you would like to list here. Okay. Look over the following list and check any of the events that you have personally experienced, okay? Okay, good. So, you had a baby who you adopted out. Physical abuse, emotional abuse. Are any of these currently active? Do you feel safe? Okay. Okay, any drug problems? Alcohol use? Eating problems or eating disorder? Mental health care, had other emotional problems but never had treatment for them. If you had postpartum depression, this is your first pregnancy, right? Okay, so. And no other children. Okay. So for your current pregnancy so far, I'm going to read off a few different things, and I just need you to tell me if you experience these frequently, sometimes, or never. Okay. Mood swings, difficulty sleeping, depression, anger, sexual problems, physical abuse, loneliness, crying jacks, worry or fear, loss of energy, loss of appetite, emotional abuse. Okay, please check off if you're having difficulties with any of the following, okay? Housing, childcare, translation services, family health care, finances, food, employment, or transportation. Now, do you feel as if you are receiving the emotional support that you require for during your pregnancy and planning after your pregnancy? Okay. Good. Do you have any worries about your pregnancy that we can hopefully help you with? Okay. You are first time, so that's normal. We're here to answer any questions you have. Are there any needs, circumstances, or issues regarding yourself or your current pregnancy that you would like us to know about or help you with? Okay. And if that changes, you can just ring us up or send us an email and we can help you with those questions. Good. Okay, that is, let me double check. I think that's the end of the emotional needs questionnaire. Good. Perfect. Let me just grab the other one now. I know, so many paperworks, but it's good for you and baby to have this on file. Okay. Okay, so for the general client registration here, patient registration I should say, Okay, so your name and middle and last name we have already. Good. What is a good phone number for you? Okay. Marital status we have on this page, as well as occupation. Sometimes the forms kind of duplicate each other, so. Okay. Your date of birth? And can I get your partner's full name? And what about their date of birth? And the address. Yeah, I need your address. Okay. Good. We have your zip code, but I don't think I grabbed your address. Okay. Emergency contact. Would you like that to be your partner? Okay, and their phone number. Okay, and do you want a second emergency contact? Could be a family member, friend, really, it's up to you. Okay, and what's their name? And their relationship to you? And phone number. Good. Okay. So by default, we would contact the first emergency contact first, being your partner, and then if we could not reach them, we would move on to the second, of course. Okay. Good. Okay. Alrighty. Okay, so moving on to some medical history for you, the other parent, your immediate family, things like that. Okay. So let me just look here. Now, any family, yourself or in your immediate family, so that is your parents, your grandparents, or your siblings. Okay, so anybody have diabetes, high blood pressure, kidney disease, cancer, twins, heart disease, lung disease, seizures, autoimmune disorder, a different condition you'd like me to note here. Now for you and your partner, is there any sort of sexually transmitted diseases? Okay. Alcohol, drug abuse, kind of touched on that. Okay, perfect. And anything other for you and your partner you'd like me to add? Okay, now for your mother's history, if possible, number of pregnancies, number of births, number of miscarriages, any complications throughout pregnancies for your mom. Do you by chance know what your weight was when you were born? Okay. Now, any previous pregnancies for you, this could be birth, miscarriage, or termination. Anything that I need to note? Okay, that's what I thought. Good, good. Have it accurate. Okay, good. Let me just look here. Doing okay so far? I know it's a lot of questions, but luckily we don't have to do this again. You're going to be set for the rest of your pregnancy with all of this crazy information. Okay. Move along here. Okay, so have you or your partner ever had a baby with a birth defect? Okay. Anyone on your partner's side of the family with birth defects? Okay. Do you think that you will have an increased risk for any sort of birth defects based on family history or anything I need to make note of? Okay. And then we have to ask, are you and your partner blood relatives? Okay. Alright. Now, have you or your partner ever had hepatitis or jaundice? Okay. Have you or your partner ever had to have an IV or blood transfusion? Let's see here. briefly talked about no sort of sexually transmitted diseases for you or your partner. Good, good. Okay. And then we asked on the previous paper again, but we also just want to make sure you feel safe in your home. No form of abuse or anything that you need assistance with. Okay. You feel comfortable bringing a baby. Okay, good. This is always a safe place, so if there's ever anything that you need to talk about, I am here to listen. Okay, good. Alright. Okay, just some more medical history for you today. Have you ever experienced any of these, okay? So, severe headaches, eye or vision problems, ear hearing problems, dental problems, hypo or hyperthyroid, okay, asthma, blood clotting disorder, anemia, heart disease, high blood pressure, varicose veins, okay, skin disorders, stomach problems, ulcers, liver disease, bowel problems, gallbladder problems, diabetes, hypoglycemia, bladder infection, kidney infection, kidney stones, urinary surgery, aching joints, pelvic or back injury, seizures, rheumatic fever, cancer, hospitalizations, and what was that for? Okay. When was that? Any surgeries? Good. Do you have any allergies to anything? Medication, latex, foods, anything? Okay, good. Oh, infection history. I know some of these are a little bit repetitive, but just so that we know, you have never experienced any of these infections, okay? So hepatitis A, hepatitis B, hepatitis C, HIV/AIDS, tuberculosis, the skin test for TB, okay? Received the BCG vaccine, lived with someone with TB, had chickenpox, received chickenpox vaccine, gonorrhea, chlamydia, syphilis, HPV, okay, oh, PID or pelvic infection, herpes, another STD, or another infection you would like us to be aware of. Okay. Good. Okay, so just a little bit of your gynecological history, fun stuff. Okay, at what age did you start your first period? Do you remember? Okay. And for your cycle lengths, okay. When was your last pap smear? Okay. Good. Would you say that your cycle is regular? Okay. And have you ever had any sort of abnormal paps in the past? Good. Okay. Good. Good. Moving right along here, please indicate whether you have ever had any of the following and when. Again, kind of the gynecological history, if you will. So, yeast, bacterial vaginosis, genital sores, cervical surgery, cervical polyp, ovarian cyst, fibroids, endometriosis, PCOS, abnormal bleeding, uterine surgery, breast lumps, breast surgery, infertility, or other. Okay. So none of those. We don't have to indicate a date, of course, which is great. Okay, let me see here. Okay, and then the last bit here. Is there a specific religion or custom that you would like noted on your chart? Okay. And then, are there any particular ethnic, cultural, or religious preferences during your pregnancy, your birth, or postpartum that you would like us to be aware of and participate in for your preferences? Okay. Perfect. We will make note of that for duration of your pregnancy, your labor and delivery, and of course your postpartum period. Good. Alright, let me double check. I think that's all the paperwork done, hon. I know it's a lot, but like I said, we breezed through it. Now, is there any information you want me to include in your chart, whether that be about you or your partner, your immediate family, anything we didn't cover? Okay, perfect. And of course, as I said, if you have any questions, you would just let us know. We're here to answer anything. Okay. Nothing is a weird question. Okay. Good. Alrighty, let me just pop these forms away real quick. So while you're here, I do want to get your blood pressure and just kind of listen to your heart real quick. Perfect. We did all the paperwork, boring stuff, and this will just be kind of a smaller first appointment before we see you in a couple more weeks for a little bit more of an extensive check on you and baby. Okay, good. Let me just grab a stethoscope here. You feeling okay today? Well, you're glowing, so that's always a good sign. Okay, take a deep breath for me. Okay, perfect. Let me just take your blood pressure real quick. Okay. Oops. This arm okay? Good. Perfect. Let me just... Good. Okay. So, any final questions for me? Okay, perfect. Thank you for taking the time to come in and fill out all this paperwork and get your pregnancy journey started with us. Again, as I said, any questions you would let us know. If not, it looks like we do already have you booked in for your first full appointment. Yeah, okay, good. In that case, you are free to go. Enjoy the rest of your day. We will see you soon. Bye.